in Cincinnati on 9 on your side.
Welcome back, everyone. This morning on This Week in Cincinnati, we're talking about Ohio Issue 2, a proposal to limit what Ohio spends for prescription medications in state-run programs. Now, in the last segment, we heard from those who support the plan. Joining us now is Dale Butland, who is the Communications Director for Ohioans Against Issue 2. Thanks so much for coming down from Columbus to be here today.
It's a pleasure, Tanya. Thank you for having me.
Dale, give a 30-second elevator speech on why we should vote against this.
Yeah, well, this is one of those things that sounds great. Believe me, I get it. People want to have cheaper prescription drugs. They want to have affordable prescription drugs. The problem is this deceptive initiative isn't going to fix the problem or do what it promises. In fact, every expert who has looked at this, including 3 former state Medicaid directors, a former state budget director, all say the same thing. This is going to make matters worse by raising drug costs for a majority of Ohioans and reducing access to needed medications for some of our most vulnerable people.
All right, so let's drill down on this a little bit. Yeah. The VA does pay significantly less on many medications that it orders. So what is so wrong with dovetailing off of what they're doing?
Yeah, so what the other side wants you to believe is that the VA gets this discounted price of 24%, which is a mandated discount, while the state of Ohio, they say, pays full price. That's simply not true, Tanya. Yes, the VA gets a 24% mandated discount, but Medicaid drugs, which account for 75% of the drugs Ohio buys, get a 23% mandated federal discount. And then both the VA and the state of Ohio negotiate with the pharmaceutical companies for even more discounts and rebates. So, bottom line is the Medicaid directors, and remember, Medicaid accounts for 75% of the drugs we buy, so they know what they're talking about. They say we're already paying very close to the VA price for most of the drugs we buy.
But proponents of Issue 2 say this could save Ohio and therefore Ohio taxpayers about $400 million every year.
Yeah,
that's significant.
That's what they say, but it's not true. A former state budget director has looked at their analysis, and because it proceeds from the faulty assumption that Ohio doesn't get any discounts now, that's where they get the $400 million, the state budget director says their $400 million claim is, and I'm quoting him directly, simply not true.
So your team argues that if this passes, then prescription drug companies will either just pull out of Ohio or then they'll just raise prices dramatically on their prescription drugs so that 20 or 24% is in line with what we're paying currently right now. But they will argue that, you know what, Ohio is far too large a market for any prescription drug maker to pull out of.
Actually, we're not that big. Ohio only accounts for less than 5% of all the drugs the drug manufacturers sell to the states. The actual figure is 4.8%, okay? That's number one. But number two, remember, Tanya, this ballot initiative only applies to drugs purchased by the state government. It leaves out 2/3 of the people of Ohio. Why? Because 64% of our population, 7 million people, don't get their drugs through state programs. They get it through private insurance, they get it through insurance provided by their employer, maybe like you. Maybe they're on Medicare, which of course is a national program, not a state program, so that's not included. So 2/3 of the people in the state are not even included in this thing, and their prices could very well go up.
It is also true that children's drugs specific to children would not be part of this either.
Yeah, so what you got to understand is that the VA has a very narrow formulary because they are giving drugs to military veterans. Ohio, by contrast, particularly with the Medicaid program, under law, Medicaid recipients have to have access to every drug sanctioned by the FDA, which means we buy a lot of drugs for women, children, infants, specialty drugs, and so on. Well, what happens if this thing passes? What happens if Ohio has to buy drugs that the VA doesn't buy? So now there is no VA price to compare it to. Could the state of Ohio continue to buy those drugs? If so, at what price? Well, the ballot initiative doesn't say. It's another example of how sloppily worded this thing is, and it would be an absolute bureaucratic nightmare.
The AIDS Healthcare Foundation is behind this bill.
Yeah.
And a man at the top of that is very specifically behind this bill. Yeah. Why do you think that they're coming after Ohio?
His name is Michael Weinstein. He put the same initiative on the ballot last year in the state of California.
Prop 61.
Prop 61. It went down in California by 6 points. After it lost there, he brought it to Ohio, which, by the way, all the problems that I've just been talking about were also on display last year in California. But instead of coming to Ohio and talking to anybody, talking to doctors or nurses or to the Medicaid directors or anybody who knows what they're doing and saying, look, is there some way we can fix this thing, solve the problem so we can, he didn't do any of that. He just put the same thing on the ballot this year. The irony of the AIDS Healthcare Foundation is it's a $1 billion a year foundation, nonprofit foundation. They make 80% of their money selling prescription drugs. And Mr. Weinstein takes tens of millions of dollars out of that nonprofit and spends it on political campaigns, some like this, others that have nothing to do with the anti-HIV/AIDS mission of his foundation.
He would say that he is an activist, or his foundation is an activist type foundation that is trying to get better health care, better prescription for people who are in need.
Yeah, that's what he says. But he put something on the ballot earlier this year in the state of California. It was called Measure S. It was on the Los Angeles ballot. Would have halted housing construction in the city of Los Angeles for 2 years. Why did he do that? He got mad because they were going to put a high-rise up next to his offices in downtown LA that would have blocked his view of the Hollywood sign. And I'm not making this up. You can read it. In fact, I hope your viewers will go to our website, deceptiverxissue.org. This is a book that has all the stuff in it, but you can get the facts for yourself there.
All right, Dale, thanks so much for spending time and coming down and being with us today.